Okay, hello. We're going to be doing a dermatome, myotome, and deep tendon reflex screen today. So I'm going to instruct my patient on what they're going to be doing. So I'm going to be using this Q-tip. So as we're doing this, I'm going to be swiping different areas. It's going to feel like that. So just let me know when you feel that, okay? So go ahead and close your eyes and turn away from me, please. Can you expose your thigh for me actually first, please? Thanks. All right, so I'm testing L2 here at the mid-thigh.
Yep.
And then L3 at the medial knee.
Yep.
L4 at the anterolateral tibia.
Yep.
L5, I'm at the lateral malleolus.
Yep.
And then also the dorsum of the web space between 1 and 2.
Yep.
Okay, so now at S1, I'm at the medial malleolus
Yep.
and the lateral foot.
Yep.
And then S2 is the heel.
Yep.
Okay, good. Okay, now I'm testing the other portion of the spinal cord, the spinal thalamic tract. We're going to be differentiating pain and seeing if the patient can feel it. So once again, I'm going to go down the dermatomes because the dermatomes are basically used for gross innervation from the cervical root. So we're going to start again. I'm going to instruct you. So there's going to be a dull side, which is going to be this side. So it's going to feel like this. And then there's going to be a sharp side. I'm not going to prick you too hard. It's going to feel like that. So you just differentiate and tell me if it's either sharp or dull, okay?
Okay.
So same thing. Go ahead and close your eyes and turn away.
Dull. Sharp. Dull. Sharp. Sharp. Dull.
And those were L2 and L3. L3 is the medial knee. L4 coming to the anterolateral tibia.
Sharp. Sharp. Dull.
That was L4. L5 coming to the lateral malleolus and the dorsum of the foot between the first and second toe.
Dull. Sharp. 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 Dull.
All right, now S1 medial malleolus and the lateral foot.
Dull. Sharp. Sharp. Dull. Dull. Sharp.
Yep. And S2 at the heel.
Dull. Dull. Sharp.
Dull. I can't feel anything. Okay, well, my patient might have a little bit of tissue there. He has a callus on his heel, so it could be impairing some of the sensation there. All right, so we're doing myotomes now. Myotomes are basically gross muscle groups that basically do the same motion. So, you know, hip flexion, knee extension, they all come off of the nerve roots. So first we're going to test L1, L2. So all I want you to do is lift up your knee to your chest. Lift up the knee to your chest. Good. Relax. That was L1, L2. Go ahead and extend your knee. Good. That's L3. I'm going to skip to S1 or S2 because my patient's already in position. So go ahead and sit close to the edge for me. And then bring your knee. Yeah, there you go. Good. Strength is intact. Okay, so we're testing L5 because he's already in this position. So go ahead and bring your toes to your nose. All right, and don't let me move you. Good. All right, so I'm going to instruct my patient to test L4. So I want you to walk on your heels just like this. Good. Now go back. And that's testing ankle dorsiflexion. Now go ahead and walk on your toes just like this. So that's going to be testing S1. Good. Any symptoms with any of those? Okay, so now we're going to be testing the L5 S1. We'll be testing the Achilles. So go ahead and relax again. Patient seems to have it's pretty good normal response, so I give him a 2+. Yeah, I was going to test that again. Okay, so here I am testing L3, L4 knee jerk extension reflex. So I'm going to come on this one. Sure, not in the way. we go. Well, my patient demonstrated a normal response for one of them. I just wanted to continue to check Babinski's reflex. You're going to want to use the edge of your reflex hammer here on the bottom side, and you're going to want to start laterally and kind of come through medially this way. A positive sign will be dorsiflexion as well as a splaying of the rest of the toes. So here we go. Do it one more time. And I'll do it to the other side. And nothing. Okay, so one thing I forgot to mention was kind of what the myotomes are testing at each one. So the L1, L2 is the hip flexors, L3 is the knee extensors, L4 is the dorsiflexors, so you're walking on your heels, L5 is great toe extension, S1 is the plantar flexors and the everters, and the S2 is the knee flexion. So I grouped together everything at the knee so I wouldn't have to change the position of my patient and have him sit down again.